In this lecture, we're going to focus on coronary artery disease. Now, I'm going to link up some videos that you can also watch that have some animations as to what coronary artery disease is, or CAD. Also, what atherosclerosis is and what hypertension is. Now, the reason I mentioned hypertension and atherosclerosis is because when it comes to the heart, when it comes to many diseases, many pathologies, hypertension and atherosclerosis are in the center of it. They're the cause of many different things. So I really think that you need to focus on what atherosclerosis is and what hypertension is. Because if we could get rid of atherosclerosis or prevent atherosclerosis or hypertension, we can definitely eliminate a lot of the pathologies that occur because of them. Okay, so let's take a step back and focus on both of those first. Now, in our lecture on hypertension, I mentioned how high blood pressure levels can cause damage to the inside layer of blood vessels, in this case arteries. If this damage occurs, one thing that can happen is your own immune system, your macrophages, will come in and they will try to seal off that weakened area. They will try to prevent a leak. They will try to prevent a rupture. So I'm needing you to picture this. So again, just imagine a leaky artery. Macrophages come in and they kind of put some cement around that weakened area. Now this cementing, or this plaque formation, will have two effects. Number one, it'll decrease the flexibility of that artery or blood vessel. So that's number one. And number two, that blood vessel will become narrowed. That is essentially what atherosclerosis is. Just a accumulation of plaque and a hardening of the blood vessel or artery. So that was if the atherosclerosis was caused by high blood pressure. Well, atherosclerosis can also be caused by, for example, fat buildup, fat deposits, cholesterol plaques, and the effect will be the same. The blood vessel will lose its flexibility, and along with that, it will lose, I lost my train of thought here. The blood vessel will become narrowed, so it will lose some space inside of that vessel. Now, this narrowing has a potential for causing an occlusion. If an occlusion happens, if blood is stopped, that leads for the potential of a clot formation. Okay, so now we're starting to see how atherosclerosis can cause CAD. Coronary artery disease is just a lack of blood supply, in this case, to the coronary arteries. The coronary arteries, remember, lead or give blood to the heart. They provide the heart with a blood supply. So if we have a narrowing of these vessels or a hardening of this vessel, then again the heart cannot get the blood supply that it needs, resulting in chest pain or angina. But again, this all has to do because the blood supply to the heart is being decreased by some type of fat deposit inside the wall of the artery. Again, due to this atherosclerosis, whether the atherosclerosis is caused by hypertension or again by fat deposits. In either case, you will have something known as plaque formation, which is simply a narrowing of blood vessels. Now, this plaque formation always has the potential of breaking off. Okay, it can break off because, again, that blood pressure can be severe enough to where that plaque is actually knocked off of the wall. Now, if that plaque gets loose, becomes mobile, it will result in a thrombus. Now, that thrombus can always cause an occlusion. If the occlusion is in the coronary arteries, it will result in a MI, myocardial infarction. If, however, that travels up, for example, to the brain, it can cause a stroke. If it goes to the kidneys, it can cause renal failure. If, for example, that occlusion, the atherosclerosis affects the eyes, it can cause retinopathy. It can cause visual changes. So one thing, atherosclerosis mixed with hypertension can cause many, many problems. Now, the thing about coronary artery disease is that the symptoms are noticed when the disease process is advanced. So typically, we do not get the angina or angina, the chest pain, until there is a severe blockage, severe occlusion. Well, by then it's hard to do something about it, is what I'm trying to point out, because again, symptoms are not noticed until the disease process is severely advanced. If, for example, the eyes are affected, well, by then you're having retinopathy. If you're worried about the kidneys, well, by the time you notice, you may end up with some type of renal dysfunction. Now, as we all know, if your kidneys begin to fail, what ends up happening is patients must undergo dialysis. Okay, so the key to atherosclerosis is preventing it. But before we are able to prevent it, we must know what the risk factors are. So let's talk about some of those risk factors and causes. Number one, increased serum lipids. Now, in the serum lipids, we have to worry about cholesterol levels, so make sure you know these for the Nclex exam. Cholesterol levels greater than 200, or fasting triglyceride levels greater than 150. Increased LDLs. Now, these are the bad fats. Okay, so if increased LDL levels, this simply means you have more cholesterol in your body. The ones that we want are the HDLs, the happy fats. These make your heart happy. Okay, so if you have increased HDLs, that's good. But in most cases, in patients with CAD, we actually find that they have decreased HDL levels. So our heart is not too happy. It's a simple way to remember it. So moving back on into our risk factors, increased blood pressure, and we just explained that in the very beginning of the lecture. So increased serum lipids, which again predisposes you to more fat deposits in your arteries, or that fat plaque buildup. Increased blood pressure causes more damage to the arteries, which again results in that cement building, which again causes atherosclerosis. Remember, atherosclerosis simply means a hardening of the vessels. Number three, tobacco use. Remember that tobacco use causes vasoconstriction. Okay, as a result, that'll increase blood pressure, which again causes atherosclerosis. Decreased physical activity, obesity. These are all risk factors. Diabetes as well. Let's focus on some interventions. Number one is if you have somebody who has severe weight issues, is likely to be obese or is obese, or has really no motivation to do anything. Well, the one thing you can do is inform them, educate them to increase their physical activity, because again, we just mentioned how symptoms are not noticed until the disease process is advanced. So we want to prevent things. So again, we want to prevent it by increasing our physical activity. Again, working out, walking, hiking, biking, anything to move, anything to burn down or burn that fat away, to bring down those cholesterol levels. Number two, change in diet. Decrease in red meat consumption, decrease in eggs, decrease in whole milk. All these contain increased amounts of fat and cholesterol. And again, we talked about how atherosclerosis has to do with increased fat and cholesterol deposits in the arteries. Therefore, if you remove the source, you're preventing it. So again, you educate your patient to decrease red meat consumption, decrease intake of eggs and whole milk. Okay, so definitely avoid the breakfast with pork chop eggs, bacon, milk, pancakes. I mean, that's just a heart attack waiting to happen right there. Number 3, now your book says increase in omega-3 fatty acids. That's just your book, not really my opinion, but your Nclex is not going to ask me on my opinion. But book's sakes, we say increase in omega-3 fatty acids. You will get this in, for example, fish, tuna, or salmon. Number 4, again, you want to tell your patient to avoid tobacco, avoid alcohol. Now let's talk about some drug therapy. Drug therapy, again, what we want is to decrease the amount of cholesterol, decrease the amount of fats. If we decrease the cholesterol, the fat levels, then we hopefully decrease the amount of atherosclerosis, the amount of narrowing of those vessels, and hopefully prevent a heart attack, an MI. So let's talk about the statins first. This is something like Lipitor. So that's our first one. Simvastatin, Zocor, Pravastatin, Pravachol. Now let's talk about Lipitor. You must inform your patients that it can cause a rash. It can cause GI disturbances. This affects your statins, typically affect your liver. Okay, so you always want to assess your liver enzymes. If you see your liver enzymes going up, this means that the kidney is starting to be affected by these medications, at which point you may have to have your patient discontinue the medication or decrease the amount. Again, that will be determined by the physician, but you always want to pay attention to your liver enzymes. And what exactly do you want to look at? Well, the liver enzymes that you want to focus on are aspartate aminotransferase, alanine aminotransferase. Again, if you see elevations in these, that indicates that the liver is becoming affected. So again, you must inform the physician immediately. Also, Lipitor and some of these statins, they increase the likelihood that the patient will suffer from something called rhabdomyolysis. Now, what exactly is rhabdomyolysis? Well, rhabdomyolysis is a breakdown of skeletal muscle. Are they getting weaker? Are they more fatigued? The one thing that you will look for in blood work is an increase in creatine kinase levels. Okay, so again, you want to monitor two things, liver enzymes and creatine kinase levels. If there is an elevation in creatine kinase levels, this indicates that the muscle is being broken down, which again indicates some form of rhabdomyolysis. Make sure you know that for the Nclex exam. Okay, these are with our statins. Now, we have something like niacin, a vitamin B. Niacin can cause severe flushing. So again, make sure you inform your patient. If they take this, it will most likely become flushed. It can also cause pruritus or orthostatic hypotension. Now, if they want to decrease those effects, they can take something like NSAIDs or aspirin to decrease flushing. Okay, now, but here we have a double whammy, because if they're going to take NSAIDs or aspirin, you want to make sure that they eat it with food, because again, we do not want to cause ulcerations. That goes back to our lecture on the GI tract. Okay, you can give something like Tricor or Lopid. Now, these are most effective for decreasing triglyceride levels. If you're going to take Tricor or Lopid, in your book it's called fenofibrate or gemfibrozole. Okay, Tricor or Lopid, again, these are the most effective for decreasing triglyceride levels. Now, you must inform your patient that, it can cause rashes, nausea, and diarrhea. Now, the important thing to remember about these is that they may increase warfarin. Okay, so with these patients, they have an increased risk for bleeding, because again, it increases warfarin, the effects of warfarin. Now, in some instances, physicians may order a combination of these medications to increase their effects. Well, these increase the effect of the statin drugs. And you must remember that, again, you worry about rhabdomyolysis and liver damage. So again, if these are taken in combination, you must know that they increase the stent drug effects. So again, you want to increase your monitoring of creatine kinase and your liver enzymes. Patient could be given something like Questran or Colistid. Now, if they're taking Questran, remember, it will most likely cause a change in their taste sensation. They will complain of unpleasant taste. Now, the longer they take it, the more this will be decreased. But if they're just starting to take the medication, they must be informed that yes, it is going to affect the way they taste things. It also causes indigestion, constipation, and bloating. Okay. Now, the thing about Questran is that it interferes with digoxin. It also interferes with thiazide diuretics, warfarin, and penicillin. So if this patient is having some type of infection and you're giving penicillin, or the physician orders penicillin, well, that's a problem because it interferes with it. So the therapy will probably not have its maximum effect. Also, if they are taking warfarin to prevent blood clot formation, well, you must understand that, again, it decreases that effectiveness. It interferes with this drug. The same thing if your patient has heart failure and they're on some type of thiazide diuretic, again, it's going to decrease the effectiveness of that drug. Zetia. If your patient is on Zetia, you must tell your patient that they have a high likelihood of suffering from headaches, GI distress. Now, you will not give Zetia to patients that have decreased liver function. And the other thing that physicians tend to recommend is a low-dose aspirin. Now, this is just an antiplatelet, and this is given again in hopes of preventing an MI.